Namaste. I'm Dr. G. Nikila Reddy, Consultant Obstetrician Gynaecologist, Laparoscopic Surgeon, and Cosmetic Gynecologist. I get warm greetings from KIMS, Cuddles, Secunderabad. So today I'm here to discuss about a very common and important topic about which a lot of pregnant women or the expecting mothers are waiting for. That is about the bursting myths about C-section. When we talk about the bursting myths about C-section, first I want to tell you that the month of April is considered as the awareness month for C-section. This is mainly to spread awareness among the pregnant women or the expecting mothers so that they will be able to know the benefits and the process of labor birth. These days, the C-section rates have been commonly increasing. So it is accordingly, the myths and misconceptions have also been raised. So it is important to know the facts about the C-section so that the expecting mothers would be able to have their informed decision, and also they will be able to handle their anxiety and decrease of fear about the process of the childbirth. So what are the myths? I want to talk a few myths which I encountered in my daily practice. So what they would come to me and ask about is like, are the C-sections always planned? Yeah, sometimes we do plan or schedule C-sections prior in advance, but most of the times they are done under emergency basis because we encounter some complications during labor. So this is a most important thing which all the mothers or the expecting women should be known about. And they think that the C-sections is an easy way out. But the C-sections are the most difficult when compared with the vaginal delivery because it is done through the major abdominal surgery. We cut the abdomen and the uterus and we deliver the baby. So it has its own risks and recovery challenges with the C-sections. And once a C-section is always a C-section, no, this is not true all the time. Because there are a lot of women who have had their normal delivery after C-sections, and I have a lot of successful stories regarding this, who had a C-sections in the prior pregnancy. This is called VBAC, provided there should be minimum gap of at least 2 years between two pregnancies, and there should not be any medical complications during pregnancy, so that we can always give a trial for VBAC. And when coming to the pain, many women think that C-section is a pain-free. Yeah, for a while of period, maybe because of the effect of the anesthesia, they might feel pain-free. But as the anesthesia effect weans off, the pain starts increasing, and you may have severe pain for 1 or 2 days, and the pain might decrease. But for a period of like 1 week or 2 weeks, you might have that milder pain. After C-section, the women think that they're not allowed to have breastfeeding. But this is definitely a very big myth, which I have to tell you. Because of the effect of the anesthesia, the milk letdown is very slow after C-section. For this, the mother should definitely have patience. Don't be panic. And it is very important to offer the baby to the breast in a very regular intervals so that the needs of the breastfeeding, like demand and supply, will be reached. So never be panic if the baby is unable to feed immediately post C-section. A spinal anesthesia which is being administered during C-section will cause severe back pain throughout the life. This is a very big myth because the process which we do, we have to give a spinal anesthesia, the process like which we administer spinal anesthesia is with a very thin needle. And it's being given on the lower back of the mother, and it's been administered by a very skilled profession. So the back pain could be because of the many other reasons like poor postpartum postures, or maybe because of the imbalanced hormones which cause or which trigger the laxity of the muscles, or because of the immobility which is due to the pain of the C-section might cause stiffness of the back. Otherwise, it is not because of the spinal anesthesia. And some women think that postpartum bleeding is very less after C-section. This is not true because even if you consider it's a normal delivery or a cesarean section, for both of process of delivery, the bleeding comes from the uterine cavity. So it is same in both the deliveries. So there is nothing that the bleeding is more in vaginal birth and less in C-section. Is a C-section done for the wealthy? Never the C-section is done depending upon the financial status. it is done only depending upon the medical circumstances or the medical reasons. Only the access towards the healthcare might give that influence of having this effect that it's done for the financial status, but it is mainly done for the medical reasons. And the main myth when it comes to is C-section and weight gain. This I really don't want to accept it, because at the end I want to add a note about this. I have my personal experience on this. Always the weight gain depends upon the weight that the mother has gained during her pregnancy is one thing, and post delivery how fast she has returned back to her physical activity and how she is maintaining her healthy diet. Emotional well-being is very important, and adequate amount of sleep. So all these points adds upon to the weight gain or the weight management. And the one secret which I want to tell is, even if you want to have a six pack after C-section, you can definitely have it. Because I told you that I want to tell you one example about myself. Because even I had two C-sections, and after the end of my second C-section, I had put on like 1 or 4 kgs, and now I am at 60. So this exactly depends upon how you balance your physical activity and your healthy diet. So it's basically how hard you work on your body. So this is one important thing which I want to tell you. And the biggest myth is sex after C-section is very painful throughout the life. It's a big no, because a woman might take some period of time for the recovery, maybe 4 to 6 weeks, because they feel that abdominal soreness, they feel vaginal bleeding and fatigue, and the surgical site wound should heal. That's why they take the gap of at least 4 weeks so that they could recover. Otherwise, there is no standard time that they should not return back to the sexual activity. As soon as the mother is comfortable, they can get back to their sexual activity. And immediately post C-section, whether the baby is been having the skin to skin contact with the mother or not. These days, we are making sure that the immediate post delivery, we are handing the baby, we are placing the baby in between both the breasts or on the chest of the mother, so that the skin to skin contact is being delivered. So there are no need to worry about this, because the skin to skin contact is being immediately administered post C-section also. And some of the women think that the mothers, after administering the spinal anesthesia, they think that they will go into unconscious throughout the procedure. As I said, we administer spinal anesthesia on the lower back of the mother. So there's no need to worry about this. So it's not a big panicking thing, because we don't give a complete anesthesia for a C-section. So I hope I had cleared most of your myths. If you have any further concerns, please do visit us at KIMS Cuddles, Secunderabad. Thank you. So any questions you would like to ask? Maybe about the diet. So a lot of women might think that, there are some, food items which they need to avoid, like dal or spicy foods or sugary items. See, it's not only in pregnancy. For any healthy woman, it is very important to have the healthy diet. So dal doesn't make any wound infections, or having fruits or curd, or having a non-vegetarian diet or a egg. But it is very important to avoid spicy foods and sugary items. It is important for a normal healthy woman also. It's not only for the pregnant woman. So any questions, please do subscribe or message us so that we'll get back to you. Do you think that you want to ask about when to take bath? But the minor, complaints which you can have, you can always address us. It's as soon as you are discharged from the hospital, you can take bath. There is no restriction regarding taking bath. It is important to keep your wound healthy. So take bath and keep your wound healthy, clean and dry. So this is one thing which is important. Keep changing your maternal pads to maintain your hygiene. So someone want to ask about the recovery challenge. Yeah, basically after C-section, there could be mild delay in the recovery, but unlikely in the past. Nowadays, the women are recovering very fast. Within 6 to 12 hours, they are able to wake up and start walking. So it is very important to ambulate as early as possible to get to have a faster recovery. So this is very important. Thank you so much. I hope I had cleared most of your doubts. If you further have any concerns, do visit us at KIMS Cuddles, Secunderabad. Thank you so much.